Good day, everyone. I am Maria Cesarina Rose SESBINO together with INOJALES, and today we will be presenting about dengue. Dengue is a mosquito-borne viral infection caused by the dengue virus, or DENV, which has four distinct serotypes, DNV1 to DNV4. It is primarily transmitted to humans through the bite of infected female Aedes mosquitoes, especially Aedes aegypti, which thrive in tropical and subtropical climates. Most people infected with dengue virus do not show symptoms or experience mild illness. When symptoms occur, they typically begin to 3 to 14 days after the mosquito bite and last about 2 to 7 days. The illness is sometimes called break bone fever due to the severe muscle and joint pains. Dengue can progress to severe dengue in a small proportion of cases, which is more serious condition characterized by symptoms like severe abdominal pain, persistent vomiting, restlessness, and dangerously low blood pressure due to plasma leakage. Severe dengue requires hospitalization and can be fatal if not properly managed. There is no specific treatment of dengue. Management focuses on symptom relief such as controlling fever and pain and maintaining hydration. Prevention relies on avoiding mosquito bites and controlling mosquito populations. Dengue is found mainly in urban and semi-urban areas of tropical and subtropical regions worldwide, with about half of the global population at risk and an estimated 100 to 400 million infections annually. Dengue is caused by the dengue virus, which has four types known as DENV to DENV4. This virus belongs to the Flaviviridae family. The main mode of transmission is through the bite of infected female Aedes mosquito, especially aegypti and sometimes Aedes albopictus. These mosquitoes become carriers of the virus when they bite a person who already has dengue circulating in their blood. After an incubation period inside the mosquito, the virus can then be passed on to another human through a new bite. Aside from this, human to mosquito transmission also plays a role. Even if a person does not show symptoms, as long as the virus is present in their blood, a mosquito can pick it up and continue the cycle of infection. There is also what we call vertical transmission in mosquitoes. This means that an infected female mosquito can pass the virus directly to her offspring through her eggs, allowing dengue to persist in mosquito populations even without immediate human involvement. Although dengue is mostly spread by mosquito bites, there are also rare cases of transmission. This include transmission from a mother to her child during pregnancy or birth, through blood transfusions, organ transplants, or accidental needle stick. There also have been reports suggesting possible sexual transmission, though the evidence remains limited. The virus has even been found in breast milk, but it's not yet confirmed if breastfeeding can spread dengue. Lastly, one of the biggest environmental factors is the presence of Aedes mosquitoes in areas with standing water. These mosquitoes breed in containers like flower pots, tires, and water storage around homes in urban areas, which is why dengue is so common in tropical and densely populated regions. Severe dengue often develops 3 to 7 days after the first symptoms, usually when the fever begins to drop. Warning signs to watch out for include severe abdominal pain and persistent vomiting, especially if the patient can keep fluids down. Other red flags are bleeding from the gums or nose or finding blood in vomit or stool. Patients may also experience rapid or difficult breathing, along with fatigue, restlessness, or irritability. In some cases, the skin may become pale, cold, or clammy, and patients may bruise easily. These are all serious symptoms that require immediate medical attention as they may indicate progression to severe dengue. Next is the pathophysiology and dietary management, which will be discussed by Dazzle Inojales.
Dengue infection begins when an Aedes aegypti mosquito carrying the virus will bite a person and will inject saliva containing the virus. The virus is then deposited into the skin layers, specifically our epidermis and dermis. It is where it first interacts with host cells. So once inside the skin, the virus will attach to receptors on dendritic cells and keratinocytes. This attachment will allow the virus to enter the host cell through endocytosis, after which it uncoats and releases its RNA. Now, the viral RNA is then used for protein synthesis and replication, forming new viral particles. These new virions infect nearby Langerhans and dendritic cells, helping the virus spread further. So, in response, the host will produce interferons to limit replication, but dengue has mechanism to partially invade or evade this defense. The infected dendritic cells then migrate to lymph nodes where they present the viral antigens to immune cells to further stimulate our immune response. So at this point, the virus will now enter the bloodstream, causing primary viremia, where it spread to monocyte, macrophages, and hepatocyte. So because of the liver is affected, our nutrient metabolism and storage of proteins and vitamins can be impaired, creating early nutritional consequences. So the continued viral replications will now lead to secondary viremia. It produces high viral loads that cause fever, rash, and muscle pain. So fever will increase the metabolic rate and fluid requirements of the patient, while the loss of appetite during illness will reduce the food intake, creating a negative energy balance. The immune system will then activate T cells, which release cytokines such as interleukins. So these massive cytokines will now release this massive cytokines release contributes to a catabolic state where the body will break down protein and muscle to meet the energy needs. If uncontrolled, this leads to a cytokine storm, damaging endothelial cells and causing vascular leakage. Plasma leakage will now result in loss of proteins, electrolytes, and fluids, which further worsen the malnutrition and dehydration of the patient. As the disease progresses, hematologic changes will occur, such as leukopenia, thrombocytopenia, and hemoconcentration. So these changes will increase our body's demand for nutrients to restore blood cells and immune function. Clinically, the dengue passes through three phases. The first is febrile phase, where the fever and poor appetite will dominate. The critical phase, where the vascular leakage and severe nutrient losses will occur, and the recovery phase, where rehydration and nutrient replenishment are very essential for healing. Now, the final outcome depends on severity. So, in mild dengue, patients usually recover with adequate hydration and nutritional support to restore the losses. So, in severe dengue naman, however, plasma leakage, shock, and hemorrhage will lead to critical depletion of nutrients and fluids, making timely medical nutrition and intervention very essential for survival of the patient. When we manage dengue through diet, the main goal is to keep the patient hydrated, support the immune system, and help restore blood and platelet count. First is hydration. It is very important because fever, sweating, and vomiting will cause heavy fluid loss. Patients should drink water, oral rehydration solution, coconut water, lemon water, soups, and fresh fruit juices. Coconut water is rich in potassium, which replaces electrolytes, while citrus fruit like lemon and orange will provide vitamin C, which strengthens the immunity and help the bone marrow make new blood cells. For weakness, body pain, and fatigue, foods rich in protein and antioxidants are needed. Examples are eggs, tofu, lentils, spinach, beetroots, and tomatoes. The proteins will repair the tissues and muscles, while the vegetables will provide iron, vitamin A, and antioxidant that will reduce inflammation and support the blood health. Since dengue often causes nausea and poor appetite, patients should eat light, easy to digest meals like rice porridge, boiled potatoes, curd, and vegetable soups. So this will prevent vomiting while still giving the patients energy. So to help increase the platelet count, food like papaya leaf extract, guava, kiwi, pomegranate, dragon fruit, and pumpkin are recommended. So these are the foods that are high in vitamin C and antioxidant, which protect platelets from damage and support blood production for the patient. In addition, the nuts and seeds like almonds and sunflower seeds are good sources for vitamin E, which also help protect the platelets and reduce oxidative stress. Other micronutrients also play an important role in dengue recovery, like vitamin D that is found in egg yolks, fortified milk, mushrooms, and sunlight improves immunity by activating infection-fighting cells. Zinc found in legumes, pumpkin seeds, and lean meats will strengthen immune response and helps fight viral infection. Vitamin A found in carrots, papaya, and spinach will support immune defense and reduces infection risk. Chromium in whole grain, broccoli, and nuts may help improve the patient's platelet count. So for quick energy, patients should eat rice, bananas, oats, potatoes, and milk, while iron-rich foods like spinach, beetroots, and legumes will help the patient rebuild red blood cells that are often lower during dengue. On the other hand, the patient should also avoid coffee, energy drinks, and alcohol, as this worsen the dehydration, and also avoid fried, oily, salty, and spicy foods since they are heavy on the stomach and may cause acidity and increase the risk of intestinal bleeding of the patient.